So I wrote the book because there are certain ways that I explain teeth and the different things that are related to teeth. So one day, my staff, they said, wouldn't it be nice if we had it all in one book that patients or the staff that we hire, they have a chance to actually read it and in a simple language understand what teeth, gums, and many different things regarding dentistry is all about. StarBrite mission statement is basically we fight against gum disease and tooth decay. So that's one of the things that I do promote, and I talk to my staff that the enemy is really the bacteria that affects the tooth and affects the gum. So our mission is to educate and help people to have healthy teeth and healthy gum. So what drove me to do dentistry was it's a combination of art and helping people. So back in the days when I was in college, I experienced many different majors. And by luck, I got to understand and learn about dentistry. And it basically encompassed, like it had everything that I wanted for a future career. So one of the things that I am really proud of my office, StarBrite, and the way it has been running for years, is that we are a big family. And for many of the staff that are with me, and they've been with me for a long time, they are really part of my family. And to a point that all the children that have been born during the time that the staff have been in StarBrite, I am their grandma. I am Gammy. And I enjoy that very, very much. So the future of StarBrite is, my goal honestly has been to make StarBrite an ideal dental office. Like the way the staff treat people, the way they treat each other, and our mission and our goal, helping people with their mouth. And that's what we've been striving for, and also to keep growing so we can actually help more people. So the future of StarBrite is, my goal honestly has been to make StarBrite an ideal dental office. Like the way the staff treat people, the way they treat each other, and our mission and our goal, helping people with their mouth. And that's what we've been striving for, and also to keep growing so we can actually help more people. So the way I came about writing my book was to just talk and just say what I say on a day-to-day basis when I see a patient. Like my way of educating patients, how I use different models, and to make sure that the patient do understand. So that's how I started. I started videoing and I started recording, and we put all of those together as a book. So I know many people have questions about how often do I need to see a dentist. So the number every 6 months didn't just come out as an arbitrary. It's actually, there's research behind it, because every 6 months give you a chance to make sure that there is not bacteria accumulated that you cannot clean yourself. So you allow a professional to do that. Also, if there's something going on, if it's checked every 6 months, we can catch it before it actually gets big. So minimally every 6 months, but there are cases that patients actually do need to get a checkup every 3 months or every 4 months. So as far as how I handle patients that are very nervous about dentistry, The first step is just to understand that dentistry can be scary. And there are patients that have had bad experiences in the past. So the first thing I do is just acknowledge the fact that I understand they're scared. There are many, many ways to help a patient to be calm during the procedure. I usually do offer them to bring like a book on tape so they can get distracted. There are many, many ways of breathing exercises that I do with the patient to just calm the nerve, and also to make them understand that the present experience does not have to be what they experienced in the past. And most of the time, we get through that. We get through the nervousness. I have been asked, what do you wish that people asked you more about when they come to a dental appointment? Honestly, the biggest thing is prevention. Like, I would love not to have patients come in just for emergencies, and that they come because they want to know how to prevent future problems. So all different techniques, all different, materials like toothpaste, floss, or different gadgets. There's so many things around. I would love to spend more time educating about that than what an infection is, what a root canal is. So yes, prevention is definitely the topic I like to talk about. The most rewarding part of my job is honestly getting a patient out of pain and just seeing their personality change from when they walk in and what they've been experiencing for sometimes many months, and then to see that real, true individual to come out after the pain is gone. And it is so rewarding that so many times they want to give me a hug, and they are so happy that they actually are not experiencing the pain. So that's one of the biggest rewards part of my job as a dentist. Something that surprised me about dentistry when I started is how many people actually really have very little information about teeth and how teeth are connected to our heart, to our body, to the brain. And it was for me a surprise that many times patients did not know how this is giving them headaches, like how a tooth infection can create headaches, earaches, or even total body issues. So, and I realized for many, many, many years, teeth have not been an important part of people's life. And I realized patients have been thinking of teeth as just a separate part, and they don't know how it's connected to the rest of the body. So I am asked, what is the hardest part of my job? The hardest part of my job is when I can't help someone due to different reasons. Like, because I do pride myself that I can communicate and I can make a person understand their situation, but it doesn't work with everyone. And for whatever reason, it does hurt me when I feel like I can't help. So, and dentistry is complicated. There are different things that are connected to dentistry, and the hardest part is for me not being able to help. The most satisfying part of my job is when I run into a patient and they said, "Oh my God, you don't understand how much you changed my life." So, and it's just random. Like sometimes I even run into patients out on the street, in a mall, or in a shopping center. And as a matter of fact, one time I ran into one of my patients as a nurse, and she brought other people to introduce me to them because she said I changed her life. The question that I get asked every day is, why doesn't someone make a dental handpiece that is less noisy and less frightening? Um, that's like usually comes up at least once or twice a day. And my answer is, technology has gotten so much better. And I have been in this field for 35 years. And definitely the advancements have been very, very, very strong. But we're not to a point that the handpiece or the drill that we use is silent. But it's a goal to shoot for. So the question on what it is interacting with other dentists, well, I have to say, sometimes it's good, and sometimes it's not. I do challenge myself with the younger dentists because I know their expectation when they come out of dental school is like not real. But also, it's just to be able to be a mentor is definitely very high on my list. And I do like to help with their future career, the question they have, and just what is life as a dentist. So to answer the question on how is dentistry changed over the years, I do have to say, if you ever are around Baltimore area and you can actually go visit the museum at University of Maryland Dental School, you will see basically how and where it started. So dentistry, literally less than half a century ago, was being done even in a barber chair. And now with the technology, even in the 30 years, 35 years I've been a dentist, the technology has improved and has advanced so much that just to keep up with it, it's fun and it's challenging. So many aspects. The computer system that, let me tell you, I can confess, I wasn't a big fan of it 20 years ago, but right now it's like we can't live without it. So it has changed a lot. So do I have a favorite patient stories? I've been a dentist 35 years. I have so many that I know. Even one time my office manager was like, I should actually write a book about these favorite patient stories. But one of my most favorite is one time a patient that I had made false teeth for. And we always do say, be very careful where you put them so you don't throw them away. That reported to me that his dog took the teeth and disappeared. 17 years later, he was gardening and he called me because he dug out his denture inside the garden, and the dog has actually dug out a hole and buried the teeth. And we both were laughing for so long because it was just unreal how smart dogs are. So what is the hardest thing with working in people's mouth all day? Well, you learn after a few years being a dentist that for that amount of time you're focusing on a very small area. So you kind of lose the perspective. That's why I do recommend getting up, taking a walk, looking around, so then you can see more than just that small area. But again, after a few years, you do get used to that. But you do become very precision on working in a very small area. So the most interesting thing I found out about teeth actually really happened very recently. Like, of course, I know the connection of teeth and the rest of the body, but just learning and being through cancer treatment with a family member and going through one of the really most advanced cancer centers, that I found out that the cancer treatment doesn't get started till the patient is completely out of any dental infection. Like the first stop is in a dental clinic at the cancer center to make sure there's no gum disease, there's no tooth decay, because the treatment, they say, is not as successful if the patient has any teeth or gum disease. To me, that was very interesting, and I was very impressed actually with that center. So sleep apnea is a condition that it does need to be diagnosed by a medical doctor. Now, once the patient knows they do have a sleep apnea, which what it is basically momentarily, like the times that the patient either stops breathing at night during the sleep for a few seconds, or a shallow breathing. But again, there are sleep tests that needs to be done. That's done by a medical doctor and a sleep center to diagnose the patient with sleep apnea. After they're diagnosed, depending on what stage they are, they come to me as a dentist, and we can discuss what other dental appliance or what other things they can do instead of, or in conjunction with using a CPAP, which is a machine that kind of delivers air for the patients who have sleep apnea. So there are many different ways that a patient can be helped to get a better night's sleep, which it does affect every organ function, it affects their day. So handling sleep apnea is very, very important. What's the worst thing someone can do with their teeth? Crunch ice. There are many other things that are not good, but as a dentist, honestly, seeing or hearing someone chew ice, it raises hair on my body. Like I get just very, very tense, because I know what that is doing to the tooth or to the teeth, because it's a hard, cold substance that's affecting the crystal of the teeth, and it creates crack lines, which it might not show as a problem right away, but down the road it's the cause of a lot of issues with tooth infection, teeth needing root canals. So yeah, one of the worst one would be chewing ice. So the question on how does bacteria form in our mouth? Bacteria actually lives in our mouth. So, and again, useful bacteria, bad bacteria, and depending on what we have in our mouth, it basically allows what bacteria grows and which are the most damaging to the gums or to the teeth. So again, oral hygiene and keeping food out, because when the food sits between the teeth and it's not cleaned, those are the bad kind of bacteria that grows, and that's what can affect the health of the teeth and the health of the gum. So I have been asked the question about how do dentists and doctors, like physicians, what's their connection? How do they connect? Just throughout my career, I do have to say, it has gotten a lot better, especially with cardiologists, or there are some specialties that they know is the best for the patient before they go through any surgical treatment or any kind of treatment, to make sure they have had a dental checkup. Because I have noticed that their education, as far as for the physicians, when it comes to mouth, it is getting better, because back in the days, it seems like medical school kind of skipped the teeth area and they separated this section to just be exclusively for dentists. So sometimes there would be a disconnect, but lately I have seen, and I do sign like a lot of clearance forms that patients do bring before their procedures that their doctors have asked them to verify that they don't have any dental or gum infection before their treatment.